All right, let's dive into a connection that sounds, well, kind of out there at first, the one between your jaw and your pelvis. It might seem strange to link your mouth to your hips, but stick with me because the position of your jaw can have this huge cascading influence on your posture, how you move, and maybe even your overall health. So, have you ever been there? You've got this nagging back pain, or maybe it's your hip, and you have stretched, you've strengthened, you've foam rolled, you've done all the things, and yet you get zero relief. It's so frustrating, right? You keep treating the spot that hurts, but the pain just keeps coming back. What if the real problem isn't actually where the pain is? So let's really get into it. The research we're looking at today makes this fascinating case that a lot of chronic issues, that stubborn hip or low back pain, can often be traced all the way upstream to your jaw. I know, it sounds a little wild, but it's all rooted in a really simple idea. Your body is one single interconnected system. Your feet don't work in isolation from your teeth. An imbalance in one area forces the rest of your body to compensate, and that creates this cascade of tension. Okay, so how does this actually happen? It builds into what the sources call a domino effect, a chain reaction both mechanical and neurological that can start with something as seemingly small as your bite. This quote from Dr. Thomas Atlee just nails the idea. A malocclusion, which is really just a fancy way of saying an uneven bite, kicks off unbalanced muscle use. And those imbalances, they don't just stay in your head and neck, they travel. And here's exactly how that chain reaction plays out. It starts with that uneven bite that forces your jaw and neck muscles to work unevenly. This then creates a slight asymmetry in how you hold your head and neck. Now, to keep your eyes level with the horizon, your spine has to compensate, and that compensation travels all the way down, eventually leading to a misaligned or tilted pelvis. But here's where it gets really interesting. This isn't just a mechanical issue of bones and muscles. Oh no, your nervous system gets involved in a big way. It interprets this constant low-level imbalance as a threat, and it basically flips on your body's alarm system and just leaves it on. This leads to a state called systemic extension. Basically, your brain perceives that misaligned jaw as a danger. In response, it locks your whole body into this defensive fight-or-flight posture, getting you ready for an emergency that never actually happens. And you can actually see the signs of this. It creates a really recognizable pattern, that forward head posture, an arched lower back, and muscles that are just chronically tight and overactive, especially in the neck, back, and hips. This state even messes with your breathing, making it shallow and driven by your neck muscles instead of your diaphragm. The reason you get stuck like this is that the signal never turns off. That mispositioned jaw sends a continuous threat signal to your brain. So your sympathetic nervous system, your body's gas pedal, stays floored, and your calming parasympathetic system, the rest and digest side, never really gets a chance to take over. Now, this all sounds plausible, but can you actually see it happen? Well, the sources we looked at highlight some pretty incredible demonstrations that show this connection in real time. And let me tell you, it is a real aha moment when you see it. In video demonstrations, the effect is immediate. It's stunning. You can see someone who is literally unable to move their leg inward or rotate their shoulder. Then, all they do is simply slide their jaw forward into a better position and boom. Instantly, full range of motion comes back as those overactive muscles just let go. The sources describe this perfectly as a circuit breaker. That simple change in jaw position interrupts the threat signal to the brain. The nervous system calms down, and that systemic fight-or-flight tension just dissolves in an instant. It's powerful proof of just how directly the jaw is wired into the body's master control system. So, faced with all this, the natural question is, what now? Well, this isn't about diagnosing yourself. It's about shifting your perspective, about changing the way you think about where chronic pain might actually be coming from. Here's the key takeaway. If the true cause of your pelvic issue is all the way upstream in your jaw or your neck, then only treating the pelvis is like trying to fix a leak by just mopping the floor. You're addressing the symptom, not the source. You have to look at the whole system. The source material suggests a few avenues for people who feel like this might apply to them. This could mean looking for professionals trained in postural restoration who specialize in this kind of total body view. It might involve finding a dentist who understands how the bite integrates with the rest of the body. The crucial point is that if there's a structural issue like a misaligned jaw, standard exercises might not work until that upstream problem is addressed first. So, we'll leave you with this question to think about. When you recognize that your body is a single, deeply interconnected system, it completely changes the way you look for solutions. It's not just about where it hurts, it's about the entire chain of events that led to the pain in the first place.